Invasive cardiac diagnostic tests. In cardiology, diagnostic tests are performed to establish the presence or absence of disease. Diagnostic tests can be of two types, invasive and non-invasive. While some conditions can be established through history and non-invasive tests, others are detectable only through invasive testing. Invasive diagnostic tests are procedures that enter the body by cutting or puncturing the skin, or by inserting instruments into the body. Invasive tests are used to measure pressure inside the heart, evaluate arteries delivering blood to the heart, observe how well the heart is pumping, look for blood clots inside the heart, assess the function of heart valves, and identify heart rhythm changes. A coronary angiogram, also called cardiac catheterization, is an X-ray technique that shows where and how much the heart's arteries are narrowed or blocked and how well the heart muscle is pumping. A small hollow plastic tube called a catheter is passed through an artery in the groin or wrist. A long flexible tube called a catheter is guided through the sheath to reach the heart. A local anesthetic will be administered with a tiny needle to numb the area where the catheters are inserted. A special dye is injected into the arteries to highlight the blood flow through the arteries, so it is visible on the X-ray. Electrophysiology is a test done to assess the heart's electrical activity and is used to diagnose abnormal heartbeats or arrhythmia. It is performed by inserting catheters and wire electrodes that measure electrical activity in blood vessels that enter the heart. A local anesthetic will be administered with a tiny needle to numb the area where the catheters are inserted. A transesophageal echocardiogram is a procedure to get close-up views of the heart. A flexible telescope with an attached ultrasound scanner is placed down the esophagus. The ultrasound scanner takes images of the heart which are used to assess heart chamber or valve problems or check for possible blood clots in the heart. Thallium stress tests are used to check heart function when patient is physically active, by using exercise machines or drugs that mimic the effect of exercise. A small dose of a radioactive tracer is injected into the bloodstream. After that, a special camera is used to detect energy differences from the tracer in the heart's chambers and valves and can show how strongly the heart beats. When the heart muscle is damaged, it releases proteins like troponins into the blood. A blood test is done by taking a small sample of blood through a needle inserted into a vein, which is called venipuncture. This blood sample is sent for testing in a laboratory. Blood tests can measure the levels of these substances as well as blood fat and help decipher the amount of heart damage. Invasive diagnostic tests are procedures that enter the body by cutting or puncturing the skin or by inserting instruments into the body. Invasive tests are used to measure pressure inside the heart, evaluate blocks, clots, valves and arrhythmias in the heart. Some of the commonly used diagnostic tests are coronary angiogram, electrophysiology tests, transesophageal echocardiogram, thallium stress test and blood tests.